Welcome to OrthoNebraska's Shoulder Education class. The purpose of this class is to help you better prepare for life following a shoulder surgery. The specific objectives of this class are to review shoulder precautions and wearing your sling, to review a variety of activities of daily living, and to address some helpful hints for managing at home. Plan to follow all shoulder precautions closely for the first month, or until your surgeon clears you to move more normally. Shoulder precautions. Sling wear. During the first month or so, you will be wearing a sling at all times, even at night. The sling will help prevent excessive movement, but it likely will not completely immobilize you. Therefore, it is very important to keep your surgical arm as still as possible. It is recommended that you take the sling off for dressing, bathing, and exercise only. Your doctor will instruct you when it is okay to wear the sling less or go without. The first precaution to follow is to avoid lifting your arm in front of your body. The picture shows a person lifting their arm straight forward. You will want to avoid any kind of movement that brings your arm forward. Keep your arm down, held in place with your sling. The second precaution to follow is to avoid lifting your arm behind your back. When your arm is in a sling, this motion often looks like your elbow moving backwards. Again, keep your arm at rest at your side and held in place by the sling. The third precaution to follow is to avoid lifting your arm out to the side. When wearing a sling, this motion looks like your elbow moving out to the side. Again, keep your arm down with your elbow resting at your side and held in place by the sling. The fourth precaution to follow is to avoid rotating your surgical arm out to the side. Your sling will help prevent this motion. However, when the sling is off, for example with dressing or bathing, be careful to keep your forearm turned into your torso rather than swinging outwards away from the body. The fifth precaution to follow is to avoid putting any pressure into the shoulder by leaning onto your elbow or forearm. Do not use your surgical arm to push up from a chair or bed, and do not lean on your surgical arm on an armrest, counter, or other hard surface. Again, plan to follow all of these precautions closely for the first month or until your surgeon clears you to move more normally. After shoulder surgery, it is important to keep your shoulder muscles quiet and relaxed during your recovery period. This will allow for optimal healing. Follow these shoulder precautions until your surgeon allows you to move more normally. Do not move your surgical arm forward. Do not move your surgical arm backward. Do not move your surgical arm sideways. Do not rotate your surgical arm out to the side. Keep your surgical arm at your side with your elbow and forearm resting in the sling. Wear the sling at all times, taking it off only for dressing, bathing, and exercise. Avoid pushing up on an armrest, pushing up from a bed, or leaning onto a counter. Activities of daily living, sleeping and positioning. Following shoulder surgery, you are allowed to sleep in a bed or in a recliner, whichever is more comfortable. Some people opt to sleep in their beds, but others find a recliner better, especially at first. If you choose to sleep in a recliner, think about how the recliner operates and whether you will be able to manage that safely. A pull handle may be more difficult to operate than an electric recliner. If unable to manage moving the chair up and down yourself, you may look into modifying the chair or having someone help you put the foot up or down. While sitting in a chair, it is important to have your surgical arm supported by pillows, one behind your arm and the other placed at your elbow. The pillow at your elbow should be taking the place of an armrest, not placed on top of the armrest. If pillows feel too bulky, you can also use a folded towel, a folded blanket, or a smaller toss pillow. Whatever gives you good support without causing you to break your shoulder precautions. Activities of daily living. Bathing. Prior to discharge from the hospital, your nurse will go into more detail about wound care and dressing changes needed for your incision. You may decide to sponge bathe for a few days after surgery, especially if you are experiencing a lot of pain or excessive fatigue. Some people opt to sit in the shower initially for safety and for more arm support. If you are tired or in a lot of pain, you may like this option. You are allowed to stand in the shower if you are comfortable with this. If you have a shower chair or built-in shower seat, keep them close by in case you feel the need to sit down during your shower. If you sit in the shower, you can let your surgical arm rest on your lap. To wash under your surgical arm, you can take a washcloth or soapy fingers and swipe up and under your armpit. If you are standing in the shower, let your surgical arm dangle at your side, and then similarly, you can use a washcloth or soapy fingers to get under the armpit. You can dry under your arm the same way. Some people use a dry hand towel or dry washcloth to dry under their arm, as this is less bulky. Make sure you have someone nearby when you are initially showering. They can assist you or gather items for you before or after the shower. Keep your shower short and not too hot. Very hot and steamy showers can increase fatigue and can also make people feel lightheaded or dizzy. When you are finished bathing, get dressed and put the sling back on as soon as possible. Activities of daily living, feeding and grooming. It is important that you should not attempt to bring your surgical hand up to your face for eating or grooming. Your non-surgical hand, or your good hand, should be the one used for all eating, drinking, or grooming tasks. If you are having surgery on your dominant arm, it will likely feel awkward to eat and do grooming tasks with your non-dominant hand. Practicing these tasks ahead of time can be helpful so you are more comfortable doing them after surgery. Your surgical hand, while in the sling, can be used for very light tasks or to assist in holding and manipulating lightweight items. For example, you can hold your toothbrush to load toothpaste onto it, hold your phone while you text or use an app, or use the hand to open lightweight containers. Just make sure the hand does not come up to your face. 1 pound should be your weight limit for objects held in your surgical hand, which is equivalent to a bottle of water. If you are having surgery on your dominant arm, it is recommended that you practice toileting hygiene using your non-dominant hand. This will likely feel awkward at first, but practice does make it easier. Activities of daily living, dressing. Clothing choices need to be kept simple following shoulder surgery. Elastic waist pants, button-up or zip front shirts that fit loosely, and slip-on shoes. Try to avoid extra fasteners like belts, zipped pants, and tied shoes. Women can wear a bra, however the strap should not be worn over the surgical incision. That strap needs to stay tucked under the arm. Women may opt to go without a bra, have someone help put the bra on and off, or choose a simpler style. Here you see some examples of good clothing choices, including elastic waist pants, front closure shirt or jacket, slip-on shoes, and a simple bra without straps. If you have good balance, you may find it helpful to stand up with your arm bent at 90 degrees. If you do not have good balance, sit down with your surgical arm supported on your lap. Use your surgical hand to help hold the opening of the sling. Use your good hand to slide the sling fabric behind your forearm, hooking it around your elbow and then pulling the fabric across the front of your forearm. Use your surgical hand to now hold the rings of the sling. Grasp the strap, sliding your fingers forward to the end of the strap. Swing the strap behind your shoulder and pull it forward across your opposite shoulder. Slide the Velcro tab through the rings and fasten it against the strap. Place your thumb into the thumb loop. A well-fitting sling should now allow your arm to be bent at 90 degrees with your wrist covered but your fingertips still visible. The strap is adjustable on the front and back. Keep the front of the strap adjusted so it can come up to approximately your collarbone. Unfasten the Velcro strap on the front of the sling. Pull the strap through the loops. Swing the strap around your surgical shoulder and carefully pull the fabric off your forearm. Allow your surgical arm to dangle quietly at your side. If you have good balance, you may find it helpful to stand up with your arm dangling at your side. If you do not have good balance, sit down with your surgical arm supported on your lap. Thread your surgical arm into your shirt sleeve. Keep it still as you put the shirt on the rest of the way. Pull the shirt around your back using your other hand. Place your good hand into your sleeve. If your shirt buttons, fasten the buttons using only your good hand. Stand in front of a mirror to make sure your buttons are lined up right. If your shirt zips, you can carefully use your surgical hand to engage the zipper. Pull the zipper up using your good hand. Unbutton or unzip your shirt using your good hand only. Take your good arm out first. Pull the shirt around your back and carefully slide it off your surgical arm.
Home management. It is a great idea to have a plan in place for help with daily activities after surgery. If you live alone, you may think about having someone stay with you for a few days, possibly a week or more if possible, depending on how much help you need with day-to-day tasks. Helpers can assist you on stairs initially, help with dressing or bathing, household tasks, exercises, and can also drive you to appointments. You will not be allowed to drive until you are off all narcotic pain medications and you have gotten clearance from your surgeon, so plan on having a driver until then. Practice. Practicing your new techniques before surgery will go a long way in helping you be physically and mentally prepared for life after surgery. With dressing, practice getting dressed using only your non-surgical hand. Put pants and a shirt on one-handed, practice fastening or unfastening buttons one-handed, and practice putting on socks and shoes using only the one hand. This will also give you an opportunity to look through your current clothing choices and decide what will work well for you during your recovery period. If you are having surgery on your dominant arm, practice toilet hygiene using your non-dominant hand. For mobility, practice walking around your home as if your arm was in a sling. If your balance feels off, you may benefit from a cane after surgery. Also practice getting in and out of your bed, your car, and your shower as if your arm was in a sling. This will also help you decide the best place to sleep and may give you an idea of whether or not you will want a shower chair or bench. Discharge plans. Have your helpers all pre-arranged prior to surgery for the easiest transition to home. Also think about having a backup plan and extra helpers potentially, just in case your initial helpers are unable to do so. Questions. It's normal to have questions leading up to surgery. For any medically related questions, please contact your surgeon's office.